Okay, so we have discussed general antimicrobial agent, but henceforth, okay, we are going to discuss the specific antimicrobial agent. Specific in the sense like today we are going to study antiviral drug. Okay, so this is specific to virus. Okay, in next lecture we can discuss anti-TB drug. So anti-TB drug is again specific. Okay, so like that we have to cover now specific antimicrobial agent. Okay, now see, this is the overview of the virus. So first of all, we will try to see the nature of virus. Okay, then only we can understand the antiviral drugs. Now see, virus is a obligate intracellular parasite. Okay, it is an intracellular parasite, then lack both cell wall and cell membrane. So as we have studied penicillin, okay, so penicillin, then cephalosporin, okay, so they are targeting cell membrane. Okay, for example, if this is the microorganism, so the cell membrane is inhibited by the penicillin and cephalosporin. So now we cannot use penicillin and cephalosporin for virus because these two, penicillin and cephalosporin, they are acting on cell wall and cell membrane, and virus is not having cell wall and cell membrane. Okay, at the same time they do not carry the metabolic process like folic acid synthesis. Okay, so they are not forming folic acid, so again we cannot target the metabolic process. So this is a special or specific characteristics of the virus. It is not having cell wall, it is not having cell membrane, at the same time it is not carrying out the cell metabolic process. Then use much of the host metabolic machinery. Okay, so the virus is using host, for example human being, so it is using human beings metabolic machinery for required for the survival. Then the clinical symptoms appear to be late in course of the disease. So the clinical symptom, you will observe the clinical symptoms after 4 years 5 years of infection. Okay, so this is the problem. Okay, with the we cannot we are not able to diagnose it as early as possible. Okay, so this is also one of the challenge with the antiviral therapy. Next one is, at the stage of viral infection, administration of drug that blocks the viral replication has limited effectiveness. Okay, once the number of virus is large, so now it is a challenge for antiviral drug to kill all the virus at a time. ओके, तो इसमें हमने क्या देखा कि सबसे पहला पॉइंट ये देखा कि वायरस के अंदर सेल वॉल नहीं होता है, सेल मेम्ब्रेन नहीं होता है, और मेटाबॉलिक प्रोसेस भी उसका बहुत वो नहीं होता है. इट इज डिपेंडिंग ऑन दी ह्यूमन और होस्ट मेटाबॉलिक मशीनरी. ओके, दूसरा चैलेंज क्या है यहाँ पर हमारे पास कि जो क्लिनिकल सिम्टम्स आते हैं, वो क्लिनिकल सिम्टम कब मिलेंगे हमको, जब बहुत ज्यादा डिसीज, जब बहुत ज्यादा वायरस बहुत ज्यादा मल्टीप्लाई हो जाएगा. ओके, तब जाके आपको क्लिनिकल सिम्टम मिलेंगे. जैसे आई कैन गिव एग्जांपल ऑफ दी HIV इन्फेक्शन. ओके, तो इनिशियली जब HIV इन्फेक्ट हो जाता है तो द पर्सन विल नॉट हैव एनी इशू. ओके, 3 to 4 year उसको पता ही नहीं चलेगा. उसके बाद देन द सिम्टम अपीयर्स. ओके, सो टिल दैट पॉइंट क्या हो जाएगा कि वायरस बहुत ज्यादा मल्टीप्लाई हो जाएगा, और जब वायरस का ज्यादा ज्यादा नंबर हो जाएगा तो फिर वो एंटीवायरल मेडिसिन के लिए एक चैलेंज रहेगा कि उसको कैसे उसको किल करे, क्योंकि ऑलरेडी वो नंबर इंक्रीज हो गया है. ओके, so this is overview of the virus. Now come to the classification. Now see, the classification is, first one is anti-herpes virus. Okay, or the drugs which are used for herpes virus. So the examples are like iodoxuridine, cyclovir. Okay, these are two main drugs, and other drugs are like similar, having similar mechanism of action, but the pharmacokinetics may be different or slight differences will be there. Okay, next one is antiretrovirus drug. So this can be divided into nucleoside and non-nucleoside. Okay, nucleoside and non-nucleoside, and both are acting on reverse transcriptase. Reverse transcriptase. Okay, this is the enzyme, reverse transcriptase. So both are acting on reverse transcriptase. So in short, they are called as NRT. Okay, and this is NNRT. Okay, that the full form is nucleoside reverse transcriptase inhibitor, and this is non-nucleoside reverse transcriptase inhibitor. Okay, again examples like this one is main one, this one is main one. Okay, prototypic drug is zidovudine. Here prototype is nevirapine. Okay, next one is protease inhibitor. Okay, ritonavir is an important example here. Then third category is anti-influenza virus. Okay, see, the classification indicates that we are not studying only anti-HIV drug. We are studying antiviral drug. Okay, so the virus may be herpes virus, it may be retrovirus, it may be influenza virus. Okay, is that clear? Any difficulty till this point?
Excuse me, sir. Slides are not changing.
Slides have not changed. So you just, oh, I have already explained all the slides. Okay, see, this is classification. See, in such case, you immediately point out. Okay, now see classification: anti-herpes virus, anti-retrovirus, and anti-influenza virus. Okay, so as I explained to you, in anti-retrovirus, we have three subclasses: nucleoside, non-nucleoside, reverse transcriptase inhibitor. Here it is non-nucleoside reverse transcriptase inhibitor. Here it is protease inhibitor. And the last one is anti-influenza virus. Okay, so I have identified here the prototypic drug like iodoxuridine and acyclovir. This is a prototypic drug in anti-herpes virus, in antiretrovirus. In this subclass, nucleoside, zidovudine is a prototypic drug. Then in non-nucleoside, nevirapine is a prototypic drug. And in protease, ritonavir is a prototypic drug. Okay. And in anti-influenza, amantadine is a prototypic drug. Okay, so let's start with the anti-herpes virus drug. So I'm going to explain you the concept which is important. Okay, pharmacokinetics and all that you can read easily. See, the first drug is 1.1. This is iodoxuridine. Okay, so basically this is 5-iodo 2-deoxyuridine. Okay. So this is acting as a thymidine analog. Okay, now I guess everyone knows about thymidine. Okay, so this is a part of your nucleotide. This is a nitrogen base. Okay, so this drug is an analog of this thymidine. Okay, now this drug competes with thymidine and gets incorporated into DNA. And the DNA is now faulty DNA. Okay, faulty DNA. Why faulty DNA? क्योंकि यहाँ पर thymidine bind होना चाहिए. Okay, for healthy DNA. Right? Now our drug is like thymidine. तो यहाँ पर क्या होता है? आयोडोक्स यूरिडीन जो है ये डीएनए के अंदर जाकर इनकॉर्पोरेट हो जाता है और दैट डीएनए इज नाउ फॉल्टी डीएनए. ओके, अब अगर ये डीएनए फॉल्टी रहेगा तो इसका इंप्लीकेशन क्या होगा कि यहाँ पर जो प्रोटीन सिंथेसिस होगा वायरस के लिए, तो वो प्रोटीन सिंथेसिस भी फॉल्टी रहेगा और या अदरवाइज वो प्रोटीन सिंथेसिस होगा ही नहीं. ओके, सो दिस इज द मैकेनिज्म ऑफ एक्शन. Now the third point is it is only active against DNA virus. Okay, it is only active against DNA virus. Okay, and clinical utility is limited for topical application of herpes simplex keratitis. Okay, तो ये जो आपका स्किन इन्फेक्शन है, okay, इसके लिए ही इसका मेन यूज है बिकॉज ये डीएनए वायरस, ओके, आरएनए वायरस एंड डीएनए वायरस. तो दिस इज ओनली अगेंस्ट डीएनए वायरस. Again, few problems are there like higher local toxicity, okay, रैपिड डेवलपमेंट ऑफ रेजिस्टेंस, ये प्रॉब्लम्स है इसके साथ में। तो इसका जो यूज है ये सुपरसीडेड हो गया है बाय बाय असाइक्लोवीर। नाउ दिस इज द न्यू रिसेंट ड्रग। तो इसकी असाइक्लोवीर के प्रेजेंस की वजह से नाउ आयोडोस्यूरोडीन इज नॉट बीइंग यूज्ड। Now trifluridine and vidarabine are other pyrimidine antimetabolites effective against herpes simplex virus. So this is again, these are two again examples, like trifluridine and vidarabine are other two examples which are acting like iodoxuridine. Okay, and both are called as a pyrimidine antimetabolite. Pyrimidine is what? Pyrimidine is this one, thymidine. Okay. Yes, is it clear? Iodoxuridine.
Yes, sir.
Okay. Now we can move to acyclovir. Okay, try to understand this acyclovir. See, basically, what about my slides? Are they changing?
Yes.
Yes, sir.
Okay. Now see, acyclovir. So this is basically deoxy, okay, guanosine analog. Okay, see, now this is guanosine. Okay, so this is also nitrogen base. Okay, adenine, okay, guanosine, thymidine, okay, cytosine. Okay, so these are the nitrogen bases in the nucleotide. So, and nucleotide is a basic functional unit or a building block of the DNA. Okay, इस तरह से DNA या mRNA. तो DNA and mRNA is made up of nucleotide. Okay, mRNA. And this nucleotide is having nitrogen base like adenine, guanine, thymidine and cytosine. तो यहाँ पर acyclovir is a analog of guanosine. Okay. Now see the mechanism of action here. See, acyclovir is combining with ATP and with the help of thymidine kinase, it is converting into acyclovir phosphate. Okay. Then with the help of human enzyme, it is converting into acyclovir triphosphate. So the difference is what? Only addition of two phosphate group. यहाँ पे already एक phosphate group है, यहाँ पे एक दो और group आ जाएंगे, तो ये हो जाएगा acyclovir triphosphate. Then with the help of DNA polymerase, okay, with the help of DNA polymerase, it is converting, sorry, yes, with the help of DNA polymerase, just ignore this line. Okay, with the help of DNA polymerase, again it is converting into, it is incorporating into viral DNA. Okay, and now this viral DNA synthesis is inhibited. Okay, again I am repeating for you, acyclovir is with the help of ATP, it is converting into acyclovir phosphate, then it is converting into triphosphate, and then it is incorporating into DNA. Okay, so at the end ये जो DNA रहेगा, this is the DNA synthesis is now blocked. Okay, so this is the mechanism of action. HSV is herpes simplex virus. Okay, जैसे अब सिंपल लैंग्वेज में अगर आपको समझना है, जैसे हम लोग ये बिल्डिंग के अंदर जो है ब्रिक्स लगाते हैं। ओके, अब ब्रिक्स जो लगाते हैं, इट हैज टू बी स्ट्रॉन्ग, द ब्रिक्स हैज टू बी स्ट्रॉन्ग। तो उसके बाद क्या होगा कि आपका जो वॉल है वो स्ट्रॉन्ग बनेगा। अब हम यहाँ क्या कर रहे हैं ना कि ब्रिक्स जो है वो डुप्लीकेट लगा दे रहे। ओके, यहाँ पर हमने क्या किया, असाइक्लोवीर वाला ब्रिक्स लगा दिया। ओके, क्योंकि वो गॉनेसिन के जैसा है, गॉनेसिन का एनालॉग है। तो जैसे हमने बिल्डिंग के अंदर वॉल के अंदर डुप्लीकेट जैसे थर्माकोल का ही ब्रिक लगा दिया हमने, और वो ब्रिक ऐसा है जो ओरिजिनल जैसा दिखता है, जो सीमेंट का जो ब्रिक होता है वैसे ही दिखता है। तो हमने क्या किया कि थर्माकोल वाला लगा दिया, तो आपको वॉल जो रहेगा वो स्ट्रांग नहीं रहेगा, वॉल गिर जाएगा, उसके अंदर स्ट्रेंथ नहीं रहेगी। तो इन सिमिलर वे यहाँ पर भी हम क्या कर रहे हैं ना कि डीएनए के अंदर जो है न्यूक्लियोटाइड ऐसे हम ऐड कर रहे जो कि फेक है, ओके, जो ओरिजिनल नहीं है, और उसकी वजह से क्या हो रहा कि डीएनए जो बन रहा है दैट इज नॉट स्ट्रॉन्ग, ओके। और उसका जो डीएनए का पर्पस है प्रोटीन सिंथेसिस रेप्लिकेशन, वो सब जो है डिस्टर्ब हो जाएगा। इज दैट क्लियर टू ऑल? ओके, now see pharmacokinetic parameters. So I'm not going into the details because all points are very much simple. जैसे यहाँ पर IV form, okay, you can give by IV dose, you can go with oral, topical, it can cross CSF, okay, it is partially metabolized, then excretion is through glomerular filtration, acyclovir is accumulated in renal patient. Now this is important one, okay, acyclovir is accumulates in the renal failure. Then valyl ester, which is called as valacyclovir, has a greater oral bioavailability than acyclovir. Okay, तो this is important point. Valacyclovir, ये उसका एक derivative है. This ester is rapidly hydrolyzed to ester, so we can call this as a prodrug. Okay, valacyclovir is a prodrug. Okay, it is a prodrug. What is prodrug? Prodrug is converting with the help of metabolite into active form. Okay, this is also active. Valacyclovir is also active and it is converting into acyclovir. Okay, which is also active. Okay, so you just remember here, valacyclovir is nothing but acyclovir. Okay, uses are, number of uses are there, number of infections are given here, so I'm not going into the details of infection. You can go through it. देखो यहाँ पर पूरा H simplex वायरस, herpes zoster वायरस, चिकन पॉक्स वायरस, ओके, इसके अंदर आप यूज कर सकते हो. Now come to valacyclovir. So this, as I have discussed you, this is a prodrug of acyclovir. It can be used in herpes zoster infection. Okay, next one is penciclovir. Okay, this is a cyclic guanosine nucleotide derivative. Okay, it is a cyclic guanosine nucleotide derivative. It is active against HSV1, HSV2, and varicozola zoster virus. Okay, then mechanism of action. Now try to understand this. It is monophosphorylated by viral thymidine kinase and form nucleoside triphosphate which inhibit DNA polymerase. ओके, जैसा हमने असाइक्लोविर का देखा था वैसा ही मैकेनिज्म ऑफ एक्शन है. इट इज कन्वर्टिंग इनटू न्यूक्लियोसाइड ट्राइफॉस्फेट. ओके, और एट द एंड इट इज डिस्टर्बिंग डीएनए पॉलीमरेज. ओके, देन femciclovir, it is a ester prodrug of guanine nucleoside analog. Okay, see here it is nucleoside analog. Then mechanism of action is like acyclovir. It need thymidine kinase for generation of active DNA polymerase inhibitor. Okay, जैसे अभी तक हमने क्या देखा कि thymidine kinase is converting acyclovir to acyclovir triphosphate. ओके, और वो जो ट्राइफॉस्फेट रहेगा दैट इज इनहिबिटिंग डीएनए पॉलीमरेज. ओके, then other points are very simple like uses. Okay, uses are similar to acyclovir. Then goniciclovir, this is analog of acyclovir, which is active against all herpes virus. It is more active than acyclovir for CMV. This is cytomegalovirus. Okay, then other points are not that much difficult. It is not requiring that much of discussion. Okay, so the important point here is, again I'll repeat for you, is analog of guanine. Okay, analog of guanine. So almost all these drugs are analog of guanine. Okay, एक concept ये समझना है आपको कि अगर हम duplicate और you can say inefficient duplicate अगर हम guanine, ओके, न्यूक्लियो डीएनए में अगर हम इनकॉर्पोरेट कर देते हैं तो दैट विल इनहिबिट द इफिशियंसी ऑफ डीएनए। ओके, डीएनए आपका कोई काम का ही नहीं रहेगा वो। बस ये इंपॉर्टेंट पॉइंट यहाँ आपको ध्यान देना है। और सेकंड पॉइंट इज कंसेप्ट ऑफ प्रोड्रग। Okay, prodrug is a drug which is converting to from X to Y. Okay, so that X can be prodrug, it is converting to Y, and that Y may be active. Okay, it may be more active than X. Okay, so that is the concept of prodrug. Okay, uses, it is used in AIDS patient. Okay, it is used in CMV infection. Then this is foscarnet. Foscarnet is also like similar to acyclovir. It is a simple straight chain phosphonate active against H simplex virus, CMV virus. Viral selectivity is low. Oral absorption is poor. Okay, damage kidney. Then like it can cause disease like diabetes and all. Okay, uses are in CMV, rhinitis, acyclovir resistant H simplex type of virus. Okay, if you are resistant to acyclovir. Okay, so this can be used as a option, second option. Okay, I hope I'm clear with this. If you have any doubt, any confusion till this point, so you can raise. I'm giving you 2 minutes. Yes, roll number 48. Are you there in the class? 48.
Yes, sir.
Is it clear to you? Yes. Hmm? Okay. Sure. Okay, see, you have to be attentive. That is the only solution. I'm trying my best to explain the concept. मगर अगर आप attentive रहोगे तो उसका यूज है। ओके, क्योंकि मैं यहाँ से एक्सप्लेन कर रहा हूँ, आप सुन ही नहीं रहे हो, तो फिर उसका यूज ही नहीं है। ठीक है, और ये सारे पॉइंट्स सी अगेन यू हैव टू स्टडी इट। ओके, तो अगर अभी यहाँ यही आप समझ लोगे तो इट इज इजी टू अंडरस्टैंड ना, इट विल सेव योर टाइम, क्योंकि ये सारे पॉइंट्स इट इज फॉर लाइफ लॉन्ग। ओके, कहीं ना कहीं आपको ये पॉइंट्स आएंगे, यू विल कम अक्रॉस विद दिस पॉइंट्स एंड योर कंसेप्ट शुड बी क्लियर। Okay, anyway, now come to the next category of the drug, that is antiretrovirus drug. Now this is anti-HIV drug. Okay, so this is not a new concept to you, so I'll just go through the important points. See, these are the drugs active against human HIV. Okay, which is a retrovirus. Okay, it's a type of virus, retrovirus. Then useful in prolonging and improving quality of life. So this is not cure, this is treatment. Okay, what we are doing is we are prolonging the life and we are improving the quality of life by postponing the complications. Okay, of acquired immunodeficiency syndrome. Complications like the presence of tuberculosis, presence of then anemia, presence of you can call it as diarrhea. Okay, so we can prolong the complications, we can improve the quality of life by this type of drugs. Okay, clinical efficiency of antiretroviral drug is monitored primarily by plasma HRNA. Okay, what is this plasma HRNA? जैसे अगर आपने treatment start कर दिया है, तो you should not be relaxed. Okay, you have to assess the development, as you have to monitor the presence of HRNA, HIV RNA and CD4 lymphocyte count. Okay, आपको देखते रहना पड़ता है कि ये treatment चल रहा है या नहीं चल रहा है, is it beneficial or not, or once it is losing its efficiency, then you have to change the drug. Okay, so this much attention has to be given and the doctors are giving attention nowadays. A system is set in all the government hospitals and in private hospitals, so they are having protocol at each after each 6 months, that the patient has to go through CD4 cell count and HIV RNA assay count. Okay, तो वहां पर आइडिया आ जाता है कि ट्रीटमेंट का कैसे efficiency है, कम हो रहा है या ज्यादा हो रहा है. Okay, now first antiretrovirus is zidovudine, which is developed in 1987. Okay, so this question can be asked in GPAT exam or competitive exam. Okay, so which one is the first antiretrovirus drug? Okay, so zidovudine is the first drug. over the past 20 years, okay, 3 classes have been introduced and a large number are under development. Okay, तो अभी recently, okay, this is going on, the process is going on, बहुत सारे drug आ रहे हैं market में, because it's a huge market. Okay, huge market, and still date we are not having vaccine for it, even though it is a virus. Okay, because but unfortunately we are not having vaccine for it. Okay, so the only the option is what? Drugs. Okay, now come to this point. This is a very interesting diagram. Try to understand this. I'll just explain the diagram. Okay, see, this is your HIV virus. It is coming and forming a bud here, and this is your CD4 cell. Just a second. Yeah, so see, this is CD4 receptor and this is CD4 cell. This is this complete is a CD4 cell. So CD4 cell and CD8 cell. So these two are the cells of T cell mediated immunity or cell mediated immunity. जैसे दो immunity हमारे पास, एक है आपका antibody mediated immunity और एक है cell mediated immunity. Antibody mediated immunity will form antibodies, okay, and cell mediated immunity will form cytotoxic cell or memory cell. Okay, so it's CD4 cell is one of the important part of your cell mediated immunity. Okay, तो यहाँ पर क्या होता है ना कि जो मेन प्रॉब्लम होता है, वायरस जो मेन प्रॉब्लम क्रिएट करता है वो इट इज रिड्यूसिंग द CD4 सेल. ओके, और ये CD4 सेल ही है जो हमारे लिए एक डिफेंस सिस्टम है, और ये CD4 सेल को ही काउंटर कर देता है. तो हमारा जो डिफेंस सिस्टम है वो ही डाउन हो जाता है, और जब वो डाउन हो जाता है तो फिर क्या होता है कि जो सिंपल इन्फेक्शंस है, okay, that simple infections are getting complicated in the body. Okay, I guess you are clear with this. HIV virus is targeting CD4 cell, और CD4 सेल ही हमारा डिफेंस सिस्टम है, मेन डिफेंस सिस्टम है. वो डिफेंस सिस्टम ही डाउन हो जाएगा तो पेशेंट को क्या होता है कि ट्यूबरक्लोसिस होने लगता है, डायरिया होने लगता है, तो क्योंकि उसका इम्यूनिटी सिस्टम ही डाउन हो गया है. Okay, now see, HIV is coming in touch with this CD4 cell. These are the CD4 receptor. Now it is getting entry, okay, into the cell, CD4 cell. This is human CD4 cell, right? Now see, reverse transcriptase synthesize RNA into DNA. Okay, see, this is single-stranded RNA. This is converting into DNA, so this is called as virus DNA. Okay, DNA, double-stranded DNA. Okay, virus RNA, this is virus RNA, and this is converting into double-stranded DNA. Now this is double-stranded DNA. Now अब ये क्या होता है, ये CD4 सेल का साइटोप्लाज्म है. Now it is going inside, integrate viral DNA into cell genome. ओके, अब ये क्या होता है, यहाँ पर इंटीग्रेशन होने लगता है. आपका जो मेन आपका जो डीएनए उसमें जाकर ये क्या करता है, जैसे यहाँ पर देखो ये आ गया है. ओके, तो ये जाकर इनकॉर्पोरेट हो जाता है, और वंस इट इज इनकॉर्पोरेटिंग तो यहाँ पर अभी ट्रांसक्रिप्शन होगा और वायरल आरएनए लीव्स द न्यूक्लियस. ट्रांसक्रिप्शन मींस व्हाट, के यहाँ पे डीएनए से आरएनए बनेगा. ओके, तो ये यहाँ पर वायरल आरएनए वापस बन जाएगा. नाउ दिस इज now converting into RNA from DNA, and now this is translation. Okay, translation is process of protein synthesis. Okay, और ये प्रोटीन फिर क्या होगा, बाहर आ जाएगा. Okay, this is like a now new RNA, a new virus. Okay, new virus. So this is called as protease. The enzyme here is protease, which cuts the protein. Okay, which cuts the protein, and now there is a formation of new virus, and now new virus is ready. Again I am repeating for you, HIV virus. Okay, this is coming in contact, ये इसके कांटेक्ट में आ जाएगा. अब ये वायरस के अंदर क्या है, आरएनए है, तो आरएनए कन्वर्ट होता है डीएनए में. ओके, जैसे डीएनए में कन्वर्ट हो गया, तो ये क्या है, ये ट्रांसक्रिप्टेज नहीं है, ये रिवर्स ट्रांसक्रिप्टेज है. ओके, ट्रांसक्रिप्टेज क्या होता है, ट्रांसक्रिप्टेज होता है फ्रॉम डीएनए टू RNA. Okay, D to R. This is your transcriptase. Okay, अब इसको रिवर्स करेंगे. This is your reverse transcription. Okay, तो यहाँ पर क्या हो रहा है कि RNA है, RNA से DNA बन रहा है. ओके, फिर ये DNA क्या हो रहा है कि आपका जो मेन DNA उसके अंदर जाकर इंटीग्रेट हो रहा है. तो यहाँ पर एक एंजाइम है इंटीग्रेस. ओके, इंटीग्रेस हो रहा है, और जब डीएनए में इंटीग्रेस होने के बाद यहाँ पर ट्रांसक्रिप्शन हो रहा है, मतलब डीएनए टू आरएनए. ये आपका डीएनए है, ये डीएनए से अब आरएनए बनेगा, और वो आरएनए कौन सा रहेगा? वायरल आरएनए रहेगा. और दिस वायरल आरएनए is forming protein through the process of translation. Now this is protein, and this protein is now forming a new cell, new virus. So this is the process. So where we can target here. Okay, first target we can target here, second target we can target here, protease. Okay, so these are the anti-HIV drug. I can name like reverse transcriptase inhibitor, okay, integrase inhibitor, protease inhibitor. Okay, so these are the categories of the anti-HIV drugs. Is that clear? Any question, any confusion till this point? Is it clear to all? Chalo, quickly, because we are not having time. It's
Yes,
10:50.
sir.
Yes. Roll number 100. Are you there? Are you with me? Roll number 100. I think he is not there. Yes. Roll number 65. 65. I'm noting down your number. I'm going to put you absent. Yes, 20 DPS 07. Am I audible to you?
Yes, sir.
Then why these people are not responding?
Yes, sir, audible.
19 DPS 07. Okay, fine. Now I can't take name of each and every student. You're mature enough. Yes. On the next point. Okay, resistant to AZT. Okay, occurs by point mutation. Okay, zidovudine. Okay, the zidovudine is a now the first drug. It is thymidine analog. Thymidine जैसे मैंने अभी तक बताया कि ये नाइट्रोजन बेस है. ओके, और ये न्यूक्लियोटाइड का पार्ट है. अगर हम ये न्यूक्लियोटाइड को ही चेंज कर देंगे तो डीएनए पूरा चेंज हो जाएगा, राइट? सो दिस इज इनहिबिटिंग वायरल रिवर्स ट्रांसक्रिप्टेज एंजाइम. ओके, एंड देन द रेजिस्टेंस अकर्स. जो सेल क्या करेगा, जो वायरस सेल, इट इज अल्टरिंग द रिवर्स ट्रांसक्रिप्टेज एंजाइम. ओके, सो दिस इज द प्रोसेस ऑफ म्यूटेशन. अगर आप AZT अलोन दोगे तो इट विल वर्क फॉर ओनली 1 to 2 years. Okay, due to growth of mutation. Okay, तो व्हाट यू हैव टू डू नाउ, यू हैव टू कंबाइन इट. ओके, अगर आप इसको कंबाइन कर रहे हो तो ये आपका एटलीस्ट 10 year चलेगा, राइट? फार्माकोकाइनेटिक्स ओरल इज रैपिड. ओके, देन प्रोटीन binding is 30%. It can cross placenta and can appear in milk, so you can guess the contraindication. Then toxicity is mainly ये DNA polymerase. Okay, it is inhibiting cellular DNA polymerase. Okay, तो हमारे जो सेल के अंदर के जो नॉर्मल सेल है, जो अदर देन CD4 सेल है, उसके डीएनए पॉलीमरेज को भी ये इनहिबिट कर देता है. तो उसका प्रॉब्लम क्या होगा कि यहाँ पर एनीमिया होगा, न्यूट्रोपीनिया होगा. ओके, तो जब भी हम जिडोविडिन स्टार्ट करेंगे, ओके, तो देयर इज अ श्योर शॉट assurity that the person will have anemia for few days. ओके, तो ये होता ही है बिकॉज यहाँ पर आपका जो जिडोविडिन है ये सेल्यूलर डीएनए पॉलीमरेज को भी इनहिबिट कर रहा है. इट इज इनहिबिटिंग बोन सेल्स ऑफ द रेड बोन मैरो. तो उसकी वजह से क्या होगा, एनीमिया हो जाएगा, न्यूट्रोपीनिया हो जाएगा. Okay, now it can be used like I have explained to you, at least 2 antiretroviral drug के साथ combine करना पड़ेगा. CD4 सेल काउंट बहुत ज़्यादा ये हो जाता है, रेज हो जाता है, बढ़ जाता है, और ये बेनिफिशियल है. HIV RNA टाइटर कम हो जाता है, ये भी बेनिफिशियल है. ओके, मॉर्टेलिटी रिड्यूस हो जाती है, एंड द बेनिफिशियल इफेक्ट इज few months to couple of year अगर अलोन है, बट फॉर years. ओके, अगर हम उसको कॉम्बिनेशन में यूज करेंगे. Okay, now see, this is mode of action. So I have already explained to you this point. See, this is again similar point, like this is your HIV virus, then it is viral DNA. Now it is converting into RNA. Okay, sorry, RNA is converting into DNA, and this is reverse transcriptase. The word, remember, reverse. RNA से DNA बन रहा है, इसलिए रिवर्स हो गया वो. देन नेक्स्ट वन इज इंटीग्रेशन. जैसे ये आपके न्यूक्लियर डीएनए में इंटीग्रेट हो गया विद द हेल्प ऑफ इंटीग्रेस, देन ये वायरल एमआरएनए बना रहा है यहाँ पर, और ये वायरल एमआरएनए वायरल प्रोटीन बना रहा है. और दूसरा क्या है, यहाँ पर वायरल जीनोम आरएनए है. ओके, ये आरएनए प्रोटीन नहीं बनाएगा. ओके, ये जाकर ये जो प्रोटीन बनेगा इसके अंदर जाकर वो इनकॉर्पोरेट हो जाएगा. Okay, try to understand. This is viral mRNA for protein synthesis, and this is RNA which is called as genome RNA. तो ये क्या करेगा, जेनेटिक मटेरियल बनाएगा. ओके, और ये दोनों जब ये प्रोटीन और ये जाकर ज्वाइंट हो जाएंगे तो एक नया वायरस बनेगा with the help of protease enzyme. So we can inhibit protease. So we have number of protease inhibitors. Then we can inhibit integrase. We have integrase inhibitor. We can inhibit reverse transcriptase. We can inhibit fusion and entry. Okay, so we have a number of drugs which can avoid the fusion and entry. Okay, now next one is didanosine. This is purine nucleoside analog, purine and pyrimidine. Okay, these are the two broad categories of the nitrogen bases, right? तो ये जो है ये प्यूरिन में आता है. इससे पहले हमने जो देखा वो थायमिडीन पायरिमिडीन है. वो मैकेनिज्म ऑफ एक्शन इज व्हाट, इट इज कन्वर्टिंग इनटू ट्राइफॉस्फेट. ओके, सेम वही है जो हमने देखा था, ट्राइफॉस्फेट पे कन्वर्ट होगा. देन इनहिबिट HIV रिवर्स ट्रांसक्रिप्टेज and terminate proviral DNA. Okay, then it is antiviral activity is similar to AZT, and it is used only in combination. Pharmacokinetic is somewhat erratic to acid in contrast to it is not causing myelosuppression. मतलब यहाँ पर एनीमिया नहीं होगा. It is not causing myelosuppression, right? Next one is stobidine. So it is a thymidine analog. Okay, then the mechanism of action is similar. Okay, बाकी सारे point भी similar है. Resistance develop for just like NRTIs. Okay, neuropathies and all this can be possible. Then non-nucleoside reverse transcriptase. So they are not depending on nucleoside. Okay, they are different. They inhibit directly HIV reverse transcriptase without the need of phosphorylation. ओके, इससे पहले हमने अभी जब तक भी देखा हमेशा वो ट्राइफॉस्फेट में कन्वर्ट हो रहा है, बट यहाँ पर ट्राइफॉस्फेट में कन्वर्ट करने की कोई जरूरत नहीं है. ओके, देन वायरल रेजिस्टेंस डेवलप बाय पॉइंट म्यूटेशन, नेविरापिन orally it is absorbable. Then other points are similar. It is simple to understand, you can go through. Now retrovirus protease inhibitor indinavir, it has to be taken by empty stomach. Intolerance is common. Okay, then other points are like pharmacokinetic points, you can go through it. So this is upcoming drugs, like first one is entry inhibitor or fusion inhibitor. Second one is reverse transcriptase inhibitor. So these are upcoming drugs. Okay, these are upcoming drugs. Then we have integrate inhibitors. So these are upcoming drugs. Then mononuclear antibodies. So they will inhibit this CD4 receptor. Okay, ये receptor को end कर देगा ये. तो ये बाइंड ही नहीं हो सकता यहाँ पर. ओके. देन नेक्स्ट वन इज प्रोटीज इनहिबिटर. ओके, ये इंटीग्रेशन जो हो रहा है यहाँ पर, ये प्रोटीन का जो कट हो रहा है, फॉर्म हो रहा है, so this it will be inhibited by protease inhibitor. The example is, now this is new drug. Then capsid inhibitor, ये जो राउंड बन रहा है यहाँ पर, कैप्सूल फॉर्म हो रहा है, so this is inhibited by this drug. Then maturation inhibitor, maturation process is inhibited by this drug. So all these are the upcoming anti-HIV drugs. Okay, so this much is there in antiviral drug. So it is, I guess it is already there on my SlideShare account. You can go through SlideShare account. Okay. Now just go on adding your roll numbers and then you can leave the class, leave the meeting. Simultaneously, you can leave